In this video I'm going to demonstrate how to prescribe opioids for your patients in PACU and to prescribe our acute pain prescriptions. So first I'll demonstrate how to prescribe opioids in the PACU. You need to go into the patient's power chart, go to Requests and Care Plans, click on Add. Then I want you to come up to this section here and I just want you to type in PACU. You'll see that there is a power plan which has been created, so Meds, IV, Opiates, PACU. I want you to click on that and click OK. So this is a power plan. It allows you to choose between either morphine or oxycodone, and then you are associating both an oxygen, an naloxone and a flush with the prescription. So click on whichever opioid you want, and you can see we've got a blue circle with a white cross. That means further information is required for this section. So the easiest way to do this is to first is the oxygen, is to determine which saturations you want. So let's go for 94. Press OK. Okay, so that's moved us on to the next section, and again you've got the section here, what needs more information. You click on that and then you just simply type in the maximum dose of the opioid that you're happy for this patient to receive. So if you're happy that the opioid is to be given in increments up to a maximum dose of 10 milligrams, you just type in 10. If it's 5, you type in 5. So let's type 10. Let's click sign. This prescription will be, once I've signed it now, it will be active for 4 hours. So after 4 hours, for safety, the prescription will fall off the drug chart. Okay, I'm just going to refresh that. I'm going to go to my drug chart. You can already start seeing the drugs that I've prescribed on SA anesthesia pre-populating my drug chart. Okay. Refresh that and it comes up, so we've got our oxygen, we've got our oxycodone, and we've got naloxone and things associated with it. So this will stay on, the PACU opioids will stay on for 4 hours and then drop off. This is to stop any IV opioids being given by ward staff. So if you do have a long case, make sure you prescribe the PACU power plan, the opioids, at the end of the case. If you prescribe it 3 hours before the end, you'll only have 1 hour of it available in PACU. Okay, so that's how to prescribe opioids in PACU. Other acute pain prescriptions include PCAS, PCA. So again, go back to Request Care Plans. You go to Search and type in PCA. Again, you'll see a Meds patient-controlled analgesia power plan created for a PCAS. If you want an epidural, type in epidural. You have a power plan created for epidural. You have a power plan created for paravertebrals. You have a Remi fentanyl, PCA for maternity, and then you have the local anaesthetic via elastomeric pumps or devices. So type in bupivacaine and you'll see you've got a bupivacaine via an elastomeric device. So they are all the power plans that you need to select to prescribe the acute pain prescriptions. Once you go into these individual power plans, you'll have a few questions just like those, that blue circle with that white cross to complete, which is self-explanatory. So that is how to prescribe opioids for your patients in PACU, and also how to prescribe the acute pain prescriptions.